Last year, our youngest candidate from Cork South West, Senator Michael McCarthy.
Thank you, Chair. Delegates and friends, there's a family living near me in West Cork who are at the end of their tether, trying to get an assessment and treatment for their daughter who has an eating disorder. Unfortunately, they are discovering what thousands of families in communities all around the country have discovered. Our mental health services have been criminally neglected, and things are not going to get any better under this government. Report after report has highlighted this neglect, pointing out how the most remote areas of this country, like parts of my own constituency in West Cork, get the smallest mental health allocations, and to show how the mentally ill in Ireland are still stigmatised and forgotten. More people die by suicide in this country than in road traffic accidents. And the problem needs the same focus as we have come to expect in terms of road safety. As we all know, 1 in 4 Irish people will suffer from some form of mental illness during their lifetime. Mental illness can be as debilitating and occasionally as life-threatening as physical illness. The impact of conditions such as depression, anorexia, schizophrenia extend beyond the individual into families and communities and can be the cause of great unhappiness. The sad fact is that our mental health services don't have properly resourced community care for our mentally ill, don't have enough beds for certain specialities, particularly child and adolescent services and eating disorders, don't have enough community-based services such as day hospitals, day centres, hostels, halfway houses, drop-in centres and properly staffed community mental health teams. We don't have enough psychiatrists, psychologists, social workers, therapists, nurses and backup staff. Doesn't intervene early enough to make a real difference for those who develop serious mental illness. When it comes to mental health, there is no easy solution. And families affected by mental illness are not looking for a quick fix solution, they are looking for hope. Our mental health services will be better under Labour. Wise investment in mental health services and in community supports will deliver significant improvement in the dignity and the health of the mentally ill, who are among the most vulnerable and neglected members of our community. We will build and foster positive mental health access across the community and provide accessible services for people with mental illness. We will put in place multidisciplinary community mental health teams, reducing the need for inpatient care for communities in our cities, towns and in rural areas like my own. We will shut down the psychiatric institutions which have outlived their usefulness and which undermine the dignity of their patients. We will put in place adequate outpatient services. We will introduce a suicide prevention strategy, the fundamental aim of which is to prevent suicide and deliberate self-harm. We will put together structured partnerships between the voluntary, community sector and the statutory sector to strengthen community-based suicide prevention strategies and bereavement support. Finally, we will increase the budget of the National Suicide Prevention Office by €10 million and provide a comprehensive package for all primary and secondary schools, including mental health programmes and comprehensive counselling services. Mental health is a major policy priority for our party. For too long, mental health services have been neglected, underfunded, understaffed, and we want this to change. We will make sure that for families affected by mental illness, today's despair will be replaced by light at the end of the tunnel tomorrow. And just to touch in conclusion the point that the Chair made at the introduction, the last time I was in the Helix, in front of a microphone, in the company of politicians, we made some racket. But it won't be anything like the racket we're going to make in Clonakilty on the night of the count, when we will win back our seat in Cork South West. Thank you, delegates.
Senator Michael McCarthy of Cork South West, at 29 years of age, he's Labour's youngest member in either the Dáil or Seanad, there with a welcome promise on mental health funding.